Hey guys, welcome to our last webinar of this 10 webinars that we have been having for the last week. This webinar is the only one that is going to be in English, so it's going to be a challenge for you and a challenge for us. But it's also a great pleasure that we have such a great exposer today. So let me introduce to the exposer. Today we are going to talk to the international health regulation and the pandemic preparedness. And we are having here Dr. Hiba Ghandour. She is from Lebanon. She is a medical doctor graduated from the American University of Beirut. She was a licensed officer for human rights and peace in the last term. And right now, she is a research associate at Paul Farmer Program in Global Surgery and Social Change in Harvard Medical School. Welcome, Hiba. Thank you for your time, for accepting our invitation. The time is yours.
Thank you, Danny. Thank you for having me. Hi, guys. I'm so sorry I don't speak Spanish. I am learning though, and hopefully we can have discussions later on in Spanish. So you might be wondering why someone who works in global surgery is working on international health regulations and pandemic preparedness. So the whole COVID crisis, we actually had to shift a lot of the work I'm currently doing in my program to work a little bit on COVID and pandemic preparedness. Plus, I was the liaison officer for human rights, so I'm a big fan of international health regulations. And I know it's a bit of a dry topic, so I won't be talking for too long. We'll be playing a short game right now, and then you can ask me any question you want. And again, I'm by no means an expert, but I will share with you whatever I know. So we're going to actually start off with a game. If you've known me in IFMSA, you know that I play a lot of Kahoot games. So I'm going to share with you my screen right now, and you can use your phone to log into the game. So oh wow, what can you see? I feel like it's doubling. There's something wrong, right?
Just select the Kahoot window upstairs, and that's it.
Can you see it?
Yes.
Great. Let me just turn off my camera. Okay, I don't know how to do that. So I'm just going to keep it on. So just go to kahoot.it on your phone and enter your game pin, the game pin you see on the screen, and you can choose any name you like for yourself. When you join, I will start the game. It's just a very brief game. So we have a scorpion who's joined. I'll just wait for a minute or two, and then we can get started. So again, if you're on, just go to kahoot.it, as you can see here. You don't even need to add the www dot on your phone and enter this game pin, 5131540. I feel like I'm on a game show. Okay, we have another green heart. I'll wait for another minute and we can start the game. It's a very short one, just to break the ice a little bit. Because I know these things tend to get dry sometimes. I don't want you to get bored. And this is my first time doing a webinar, so just trying to make it as engaging as possible. Green team, amazing. A lot of score people. All my love to you guys. I miss you so much, and I miss IFMSA. So I'm going to tell you a little bit about how the game is going to work. I just have 4 questions for you. For each question, you have 20 seconds to answer. You can read the question from my screen and then push the answer on your phone. Okay, and the answer is going to be the same color as the screen. Okay, so we are going to get started. So are you ready? Okay. So how can a pandemic affect a country? You have 20 seconds to answer. We have music too. So we have 1 answer so far. We need 2 more. One more answer. Oh, amazing. You all got it. You got it right. We're going to be discussing this later on. But yes, a pandemic can affect a country on 3 levels: social, economic, and political. So the next question, we have Scorpion answered most quickly. Amazing. Next question. We also have another quiz. What are the international health regulations? Do you know anything about them? Amazing. It's a public health response to the international spread of disease and not to war or natural disasters. Amazing. You guys should be giving the session, not me. Yay. Okay, so true or false? The Global Health Security Index assesses global health security preparedness. Is it true or false? And I wrote assesses wrong. Sorry. Amazing, you all got it right. Great. Green team, if you can answer quickly next time, you'll win. Okay, so which is one notable response by South Korea during the COVID outbreak? Correct. They were having, so one of you got it right, one of you got it wrong. They were having drive-through clinics for patients to get tested. They were not sending aid to nearby countries. Well, that was the most prominent one, having their drive-through clinics. So let's see the podium and who won. So Green Hearts, amazing, congratulations. Oh, that's the third place, sorry. Green team second, and in first place was Scorpion, I'm assuming, yeah. Congratulations. Okay, so we're actually going to get started right now with our session on international health regulations and pandemic preparedness, the future. So where do we go from now? So we're going to get started with a little bit of definitions just to get the ground started. So an introduction to pandemics. What is a pandemic? A pandemic is a large-scale outbreak of an infectious disease. It's usually a zoonotic disease, which is a disease contracted from animals to man. And that is how it's been. So again, it's a large-scale outbreak that can spread across borders to become a pandemic on an international level. So this is the definition. Now we're going to be discussing risks and the impact of a pandemic. So what are the chances that a pandemic will actually happen in a certain country? So the risk of a pandemic is a combination, is the addition of two risks, a spark risk and a spread risk, okay? So this might seem awfully odd when you first hear it, but it's very interesting when we get to know what it is really. So a spark risk is where is it likely to arise, and the spread risk is how likely will it diffuse. So I will give you an example. So there is a spark risk for COVID, for example, to arise from Asia Pacific, and the spread risk is what is the risk of COVID to spread if it starts in Asia. So people in Asia go to Australia, they go to Europe, and they go to North America mostly. So that is the risk associated with a spark risk in Asia Pacific. However, let's say there's a spark risk in Africa, because Africa, Central Africa and West Africa are very big niduses for pandemics to actually break out. And the spread risk of a pandemic spreading from Central Africa or West Africa is very much different than a spread risk associated with COVID, something that is starting in Asia. Because people in Africa, they tend to go to Australia and South America sometimes more than they get to go to North America, possibly. So the risk of a pandemic happening varies with the disease, and it varies with the spark risk or the place of origin of that disease. So that is the risk of a pandemic happening. In addition, why has the risk or the prevalence of pandemics been changing? So globalization has gotten more people traveling around the world in the past 50 years, but mostly in the last 20 years. More people are traveling around the world, there's more international trade, etc. So globalization has gotten pandemics to increase in frequency as people cross borders in a more easier fashion. Plus, we have a lot of high spark areas around the world, mostly, as I said, in Central and West Africa, That is mostly due to the lag in pandemic preparedness. They're not the best in preparing for pandemics, mostly because of lack of funding. We're going to discuss that at length in a bit. Plus, what we are used to usually is that influenza is the most likely to cause a pandemic from what we know, from what we've studied in the past years. The risk of having an influenza pandemic every year is 1%. So this is what we've usually known about pandemics. So what is the impact of a pandemic? That is something you guys answered in our quiz, which is a pandemic has an impact on social, economic, and political societies and countries all over the world. Well, first of all, the impact of a pandemic, it has impact on morbidity and mortality. So when someone has COVID, obviously, if they have risk factors or if they are from a certain set of population, they're vulnerable, they're immunosuppressed, they're refugees, they have less access to healthcare, there is the impact of the actual disease. But there are also multiple impacts beyond that. So the social impact of COVID, for example, which we've all been witnessing because we're quarantined, and this is one of the responses we do to pandemics, is a negative aversion to the outdoors. Right now, we're at home. Of course, we're annoyed. We want to go out. However, when we look at it on the long run, we might, as soon as the quarantine order is removed from multiple countries, we might not feel safe leaving the house. We see it now with the memes saying, oh, I'm going to wait for a month or a week after they remove the quarantine for me to leave the house, just to make sure nothing is going on. That is actually something we are worried about. Our subconscious is worried about. We don't want to just go outside because we are worried that something might happen. The outside is equivalent to danger in our minds, at least now. Plus, we can see that in China, for example, after they removed the first quarantine order, a lot of people had increase in agoraphobia. Basically, they were afraid to leave the house. Plus, don't forget that people who already have anxiety, depression, claustrophobia, their conditions have been exacerbated because of COVID-19, because of the quarantine order. So again, there's a lot of social impact. That is one. There is also an economic impact, an impact on the short run and an impact on the long run. On the short run, there are fiscal changes. What is this? I'm not an economist, but from what I've read, a fiscal change is the fact that a government has to pay extra money this year or during the process or the outbreak to be able to contain the outbreak. They pay more money for PPE, personal protective equipment. They have to pay money to
Live streaming is on.
Okay, great. So I'm not sure at which point it cut out. I'm just mentioning that there's also political turmoil that can be exacerbated in times of pandemics because a quarantine might trigger further violence or further instability. So now we're going to be talking about some basic definitions. So people have been wondering, is there something that governs pandemic preparedness? What is it? Has it been applied? What is happening around the world? So I'm going to be telling you 3 big definitions. First of all, international health regulations. I don't want to throw a lot of jargon on you. I'm going to try to simplify them as much as I can, and in the end, we can address all your questions. So international health regulations have actually started in 2005 after the SARS outbreak in 2003. So there was a delayed reporting of SARS in 2003, which was also a pandemic. And this actually got countries to, it was an epidemic, not a pandemic. This got countries to report at a later time than they should have, which got SARS to spread more than it should have had they reported earlier on. So countries came along and said, okay, we need to have some kind of regulation to make sure that we are prepared to face an international emergency that affects our public health. So people sat together, they did them in 2005, and they entered into action in 2007. And right now, any changes that happen to them are reported in the World Health Assembly every year in Geneva. So again, there was a bigger need for pandemic preparedness. So one thing you should know about the international health regulations is that they are a binding instrument of international law. What does binding mean? We have multiple instruments to actually enact change. For me, let's assume I'm a country X, okay? As a country, I can sign on a compact or an agreement or something of the sort, but compacts are not binding. If I sign on it, it's more of a recommendation the UN, the United Nations, is giving me to consider applying in my country. So whether I apply it or not, it's really up to me as a country. However, when I sign on something which is binding, I'm accountable by law to actually apply it in my country. One binding instrument is the Universal Declaration of Human Rights, for example. Another binding instrument is the international health regulations. So people are wondering, okay, since it's binding, what is going on now? Why haven't people applied it, and why is COVID such a big explosion? We're going to talk about it in a bit, but let's go back to what the international health regulations actually are. They aim to prevent, protect against, control, and provide a public health response to the international spread of disease. I don't want to just be reading, I want to be telling you that it is a mechanism for countries to be prepared for a pandemic like this. But why has it blown up in our face in most countries? Again, we're going to get to that, but let's finish the definitions. Another important definition, which is a subset of the international health regulations, is the definition of a public health emergency of international concern. What is that? That is, by definition, an extraordinary event. It is defined by two things. It's a public health risk to other states, mainly through the international spread of disease, combined with a need that might require a coordinated international response to control it. So this is kind of what we are in now. We have a risk that is spreading from one country to country, and it requires a coordinated international response. So this is a subset of the international health regulations and the definition, mostly a technicality, but it's good to know about it. It's good when you're discussing with other people as a healthcare provider, you know about these things and you can have a conversation saying, yeah, we need to have better accountability, etc. Again, we're going to get to that by the end of this webinar. The third and final definition, so you don't get too bored, is the Global Health Security Index. This index was first published in 2019, but it was enacted because the international health regulations exist. Because they exist, three groups, the NTI, the Nuclear Threat Initiative, the Hopkins Center for Health Security, and the intelligence unit at The Economist sat together and they said, okay, we need to measure how much are countries prepared to face public health emergencies. And this is the actual definition of it. Okay, so the goal of the index is to strengthen national health security and preparedness in order to address outbreaks, infectious disease outbreaks that will lead to epidemics and pandemics. So this index has a score that ranges between 0 and 100. The average for 2019, which is the first time the score was okay. Great. So again, what went wrong and why? We mentioned that the first point is weaknesses in maintaining diagnostic protocols and reporting. So as not to use a lot of jargon, what does this mean? And one important thing in pandemic preparedness is to be able to design diagnostic surveillance testing quickly so that I can, screen patients for COVID and make sure whether they have it or they don't, to tell them whether they should quarantine at home, they need drugs, etc. So there has not been a good response from countries in general in having protocols for diagnostic purposes when a pandemic happens. So this is one thing that has been recurring actually. I saw this from an article which was published in the 1960s. So imagine that this has been a recurring problem. We're in 2020 and we are still reporting the same issue. So that is one problem. Another one is tracking those who are infected is absent. So we have to know where our sick patients are, where are they going? Are they visiting young people? Are they visiting their elderly? Are they visiting immunosuppressed people? This is something that's important and was lacking in most countries' responses. Another thing, multiple countries didn't implement social distancing early on. And there's a big question about border closures. Some countries closed their borders early on, some didn't, some closed them to certain select countries. So there's a huge question over there. And this is no longer related to just public health. This is related to global security as well. So again, there are multiple things that did go wrong, and we, by no chance, can go over all of this. But where is the international health regulations? Obviously, there has been a lot of violations for IHR in this process. And mostly it is a problem because of lack of funding and lack of political will. Countries are signing the international health regulations, but they're not saying, okay, I'm going to abide by them. They just sign it and like, okay, I don't have money for this now. I can deal with it later, next year. So there was not a lot of implementation. So right now I'm going to be telling you a case study, which is basically a comparison of what happened in the United States and what happened in South Korea and how different these responses were. So for the US, it started off with several weeks of the Trump administration saying that COVID is going to disappear by a miracle. You can find all these quotes online saying, don't worry, it's fine. And this was coupled with a delay in diagnostic design. They were not able to design the diagnostic test as early as needed. And when it was designed by the Centers for Disease Control, they said that not everyone can be screened. Only certain people who were in Wuhan, or people who saw people who were sick. Only, not anyone who wants this test can get tested. No, only certain people. So again, this led to no surveillance testing being available. This was also combined with a third problem, or a third restriction, a tight restriction by the Food and Drug Administration. They had tighter regulations: who can get tested, who can get the tests, which hospital, etc. Not which hospital, but in general, they distributed to certain centers. And again, not everyone was able to access diagnostic or screening study. This got the cases of COVID-19 to go sky high, from 11 cases to more than 100,000 cases in only 6 weeks. If you compare the response that happened in South Korea, there was widely available testing early on. They had drive-through clinics. Basically, a car would be able to drive in, get swabbed, get tested for COVID-19, get their result later on. And that way, the drive-through clinic was really decreasing the load of patients going to hospitals saying, I want to get tested. They just go to the drive-through clinic and get their test. Plus, there was a release of an app in South Korea which allowed the population to know the GPS location of everyone who was sick, so that they can avoid those areas, those regions, etc. Over and above, there was a robust biotech response. What does that mean? In less than 3 weeks, they were able to design the diagnostic test and disseminate it to all regions in the country. There were 96 labs studying the tests as soon as they got them back. That allowed people to get screened, to say, I'm going to be quarantined now. I can see other people, I cannot, etc. So this is just interesting to be able to understand what is really happening, how different countries have responded. So we're going to talk a little bit more about, medicine before we go further on how we can make this better. So one leading cause of death in 2019 was respiratory diseases. It's not the most leading cause, but it is one of the leading causes. But what kind of respiratory diseases? So it was mostly non-communicable diseases, NCDs. It was mostly chronic obstructive pulmonary disease and lung cancer. So people were focusing on NCDs, obviously, because there were more cases. There was a total of 4 million respiratory disease cases and mortality cases in 2019. Obviously, we also had pneumonia, tuberculosis, and influenza causing respiratory diseases as well, contributing to these 4 million mortality cases. So this is one point I want you to keep in mind before we reach the end point. Before COVID-19, we were less focused on communicable diseases, which is not right or wrong, but it makes sense because we had more than 70% of mortality due to NCDs. So people were focused on non-communicable diseases rather than communicable diseases. Plus, don't forget that people were also focused on climate change. Climate change is no longer a risk factor. It is impacting our lives way more than for us to just call it a risk factor. It is so much more than that. There are people calling the WHO, the World Health Organization, to make climate factor a public health emergency because that is how much it is impacting our life. So there is a lot of focus on NCDs. However, communicable diseases still exist, NCDs exist, and climate change exists. And then everyone was dealing with it on its own. There was this organization for HIV, one organization for malaria, one organization for pneumonia, one organization for diabetes or cancer or climate change. So everyone was working alone. They were not working together. This is going to lead me to my third point, which is we've seen a siloed approach that is only reactive. A siloed approach is that each organization focuses on one thing. So I focus on surgery, you can focus on malaria, and you can focus on coronavirus. But that doesn't really work because all these diseases interact with each other and they can affect the same patient sometimes. So we can't really work in a siloed approach that each one works alone. Plus, our approach has not only been siloed, it has been very reactive. What do I mean by reactive? I mean that we haven't been focused on prevention. We've only been focused on, okay, if something happens, if a problem arises, we will fix it. We only react to the problem. We don't try to avoid it or prevent it. So this actually led to the explosion that we've seen, obviously, in COVID-19. So again, we've seen multiple IHR violations. And as we mentioned, these violations have happened because there is lack of funding and lack of political will. So as a country, I signed the international health regulations and say, okay, I signed it, I can fund this later, I can worry about this later, I have so many other things I have to worry about. So this has, sparked more problems. Plus, another thing that we've noticed is that China reported COVID several weeks after it started. So COVID started early in December, if not before that, and it was reported on December 31st. So why did China report it so late? And possibly, if they reported it earlier, it would have been better. And isn't that the reason why we did the international health regulations? Because SARS in 2003 was reported late. But if we want to understand why they reported late, is two reasons. One is the fear of the government appearing weak. They don't want the world thinking that the government is weak. And they didn't want to have less direct foreign investment, which is what happened during the SARS outbreak. So they didn't want to lose, a lot of investment, etc. So this is some information for you to just understand the scenario of how this is a vicious problem repeating itself and how our siloed and reactive approach is not really helping us. Another interesting fact for you to know is that the economic toll of COVID-19 so far has caused the world $1 trillion. Just imagine, had we prevented it in a better way, how much we could have saved lives and also saved the economies. So that is an interesting fact. So what is the future of global health security now? Obviously, we have to understand and engage with public health more. Public health is not just something on the side. It is actually the future of global health security. We don't just think of public health on the side. No, public health works with human rights. It works to ensure access to human rights. It works to ensure access to healthcare. And it works to ensure universal health coverage. And we cannot achieve UHC without pandemic preparedness. So what do we need? We need an effective, efficient, and an equitable, holistic approach to health. Holistic is the opposite of siloed. We have to work together. We cannot work, like if I'm interested in surgery, I can't say, okay, surgery is enough for me. But I have to work with people who work with HIV and malaria and pneumonia and tuberculosis and with everyone, because we cannot work in silos anymore. This doesn't work. It's proven to fail years and years again. So what are we currently facing? We're not just currently facing a pandemic, we are currently facing something called a syndemic, which is a synergy of epidemics that co-occur in time and place. And they have multiple complex sequelae. They have bad sequelae, and they share societal drivers. So I'm going to give you an example of our syndemic by comparing COVID-19 with non-communicable diseases. So a patient right now who has diabetes, hypertension, hypercholesterolemia right now is a great patient. He's a great example for someone who is just waiting to have a heart attack. Because COVID-19 pandemic is happening, this patient might say, okay, my symptoms, if they are having chest pain today, they'll be like, okay, I can wait until tomorrow. They might delay going to the emergency room or going to their doctor, causing their patients, causing themselves to die from heart attacks. So COVID-19 is not just impacting patients who are getting COVID-19, it's impacting patients who have NCDs. So this patient might have a heart attack at home and not even get to the hospital. We've been seeing a decrease in the number of patients who have heart attacks, but that's not true. They're still stable. They only decreased because patients are not going to the hospital because they're afraid. We also have pregnant women who need to be constantly surveilled sometimes if they have complications in pregnancy. Sometimes they might not be able to get to the hospital because of a pandemic like this. People who have depression and anxiety constantly need to go to their hospital. They need to see their psychologist, their psychiatrist to follow up on their cases. With COVID-19, this is actually making it worse, therefore making their condition worse. So what is the mitigation? What should we do? Obviously, this we have to stop the silos. There are two main solutions. So one of them is tackling the silent killers. When I say tackling the silent killers, I mean tackling hypertension, diabetes, depression, anxiety, all the blob of mental health diseases, all kinds of non-communicable diseases, cancer. We have to tackle these. We can't just ignore them. Okay, we have a pandemic now. Everyone who has a silent killer, just stay on the side. No, we have to tackle it. But we also have to prepare populations at the same time. And when we say prepare a population, we can't just say, oh, people who are between 15 and 50. No, we have to prepare the most vulnerable as well. That means the elderly, infants, people who are immunosuppressed, refugees and migrants. Every single subset of the population has to be prepared. Ethnic minorities, everyone has to be prepared for the epidemic if it's going to happen. And when we want to prepare a population for an epidemic, there are two approaches: the security approach and the health development approach. When I say security approach, means that I look at the symptoms. Okay, if someone is sick, I give them treatment, or I monitor them, or I give them, I symptomatically manage them. However, the health development approach is that I look at the upstream causes causing this epidemic. What is causing it to spread more in my country, in my city, in my state, in my region, and I manage these causes. I'm going to delve a little bit more into the health development approach before I conclude and open the floor for questions. A health development approach has many aspects to it. When we have health development approach, it's very holistic. A health development approach protects biodiversity, meaning when my government has to prepare personal protective equipment for healthcare workers, or when it has to take care of me, it makes sure to consider climate change. It is holistic. It includes professionals from every single aspect. It protects biodiversity again. A health development approach makes sure that the response is coordinated. We have access to diagnostic testing. We are going to track patients who are sick through GPS. When we have a health development approach that is holistic, it decreases inequalities or social health inequities because it looks at the most vulnerable in the population. A health development approach also strengthens local health systems, like the drive-through clinics, for example. It allows people to get tested, not necessarily without burdening, the bigger hospitals or the bigger health systems which need to cater for more complicated cases. It improves access to preventative health via telemedicine. Right now, a lot of hospitals are shifting to virtual meetings with their patients, if need be, to just prevent them from actually contracting a disease if they just want to check on themselves, maybe have a psychologist appointment, etc. So it also decreases the individual risk. And a health development approach, there's a lot of education, a lot of knowledge transmission. So it actually improves the immunity of the population by promoting healthier lifestyles, exercises via Zoom meetings, better diet. Like people will have better diets if they're elderly, etc. They tell them which vitamins they need to take, which vitamins they don't need to take, etc. So that is the health development approach, which we all need to advocate for as current or future healthcare professionals. I hope this was very educational and informative. That is it for me, and this is our time for questions. So please, the floor is open for your questions. If you have anything regarding international health regulations or anything outside IHR, I am more than ready to answer it. My camera is open again.
Yes, we have a couple of questions. The first one is someone asked, are vaccines considered in the international health regulations?
Of course. So the international health regulations also focuses on, it has certain regulations for a country to manage, for example, certain, for ships, for planes, there are certain rules that ships, planes, anything, any vessel that is entering from outside to have. So they also have to have certificates that the people on it are, for example, vaccinated. It lives up to certain standards of public health safety. So also having vaccines and ensuring them for your population is also very important. It's also part of the response of the pandemic response. So for sure, it is included, and there is one item that is binding in the international health regulations pertaining to vaccines.
Thank you. And the second one is this the first time a public health emergency of international concern was declared?
So no, this is not the first time. If we look at the definition of public health emergency of international concern, this has happened multiple times over centuries. But if you want to look at after the IHR was enacted in place, this is the first time that it fulfills the definition of a public health emergency of international concern. So since 2007, when they were enacted and implemented until now, this is the first one that fulfills the definition. The avian influenza in 2008 does not fulfill this definition because it was not, it did not require the international effort that is required now to remove COVID-19. It did require a smaller effort, so it does not fulfill the complete definition. Right now, it is the first time since 2007. So yes. Are there any questions? Are there other questions?
Yeah, they are writing. So just give me
Take
let's
your
give them
time.
a little time
Sure.
to make the questions. But yeah, so if we talk about the international health regulation, it's like the same for like the common ground with the Declaration of Human Rights that that countries like signed it, but they are not like fully they are committed to fulfill them, but they are not obligated to take some measures with this.
They are obligated because it is a binding agreement, just like the Universal Declaration for Human Rights. It is a binding agreement, so they are accountable by law. However, the problem is there is no monitoring, there is no implementation, and there is no accountability. So if I, as a country, do not abide by the regulations, I am accountable in front of the law. However, there has been no accountability mechanisms. The UN always talk, okay, we have to have accountability mechanisms every year in the General Assembly, in the World Health Assembly, but the mechanisms are never put in place for some reason. There is lack of political will. The same jargon is used every year. There is lack of political will. We don't have money. We can't do this now. It's not a priority. But they are. It is binding. It is part of international law. They have to they have to implement it, but they don't.
Okay, thank you. There's another questions. It said, which are the best approach for our actual health situation?
For our actual health, can you repeat?
Yes, what is the best approach for our actual health situation?
So personally, or for our societies as healthcare workers?
Well, it's an open question. Maybe you can say like the best approach based on international health regulations.
Well, obviously, you cannot say there is one best approach for all countries, but because the country, again, the situation differs from country to country. Different countries are better than others in certain things. Obviously, implementing, social distancing, avoiding travel for now, non-essential travel if you do not need to, is something very important. Again, avoiding leaving your house as much as possible if you do not need to, if you're not an essential healthcare worker, that is very important. But also, as a current medical student, I think it's very important to advocate with your current medical school on learning more on pandemic preparedness because you're going to be a healthcare professional and we don't know when this is going to happen again. There might be another peak of COVID in 1 year, in 2 years. We don't know. So you need to advocate with your medical schools on learning more on pandemic preparedness. You need to advocate with your hospitals on better preparedness in the hospital. How can you contribute? Sit with your hospital managers and talk to them. Tell them you want to work with them on this. Maybe reach out to your ministries and see how much do you guys implement IHR in your country and what can you do to implement it more? Can you contribute to building a holistic approach in your country if this is something of your interest? You can, I don't know, become a health minister in the future or a policy maker as a doctor and enact changes, enact a holistic approach and improve your country's response to pandemic preparedness, or go on to work with the WHO and make sure there are accountability mechanisms for the regulations.
Okay, thank you. Another question. It's the same thing that public health, sorry, public health emergency of international concern. It's the same thing as a pandemic.
As a pandemic,
Yes, if that like the meaning for both is the same or it's different, and which like the main difference.
well, basically, a pandemic is an outbreak that crosses borders. That is the definition of a pandemic. It is usually coming from an infectious disease, mostly a zoonotic disease. It's a disease that crosses borders. That is it. That is what a pandemic is. But a public health emergency of international concern is when you have a public health risk spreading on an international level that requires a coordinated response. An emergency is different than a pandemic. A pandemic is like a disease, but an emergency is a state that you declare to mobilize movement. So you can say a pandemic pushes an emergency to come into existence, but an emergency is a response you need to tackle a pandemic.
Okay, Hiva, thank you a lot for your time, for accepting our invitation to be our facilitator for the today webinar. And as I told before, it's our last webinar of this campaign that we have of 10 webinars, and I think we close it in the best way possible. So I don't know if you have something to say before we finish the broadcast.
Thank you so much for having me, and I hope this was helpful.
Thank you. Thank you for accepting our invitation. You are always welcome in the IFNSA Guatemala family. And of course, you
Thank you.
are welcome always for Scorp, I'm sure of it. So thank you guys for broadcasting this and the other webinars we have. Just here, there's one other question. I don't know if you have time for answer it.
Sure.
Okay, it says, my question goes toward countries that do not have enough funding for health institutions. Does this affect the way they implement international health regulations? What could they do to work on it?
This is a very good question. Well, ironically, if you look at the countries that lack funding, obviously it's mostly in Africa or lower and middle income countries. What can they do? Well, obviously, the WHO and the World Bank are always trying to increase funding for these causes. However, in the past, even the WHO has not had a lot of funds for this topic. And if you look more, it's just very interesting. High income countries, for example, like France, they have good implementation in France. However, they have minor territories outside their country. These small islands. Over there, IHR is not applied very well, even though it is a territory of France, but they fund it less as a country. So it's just very interesting to see how you always have this discrepancy between those high income countries. Not they are the ones who are always giving to the lower and middle income countries. In general, lower and middle income countries just really build their own capacity to stop being, part of that dichotomy. You're either high or you're low and middle income. No, I mean, we should all, it's also part of, achieving universal health coverage and equity and all of that. I think in general, these countries have to advocate for their place in WHO and the UN General Assembly more to have better funding allocated to them and just basically protect their right to exist and protect their right to have better implementation of these regulations through better funding and better capacity building, of course.
Thank you, Hiva. So one of the main goals of these webinars was to open a space for discussion for the IFMSA members and people who was following us to tackle these topics that most of the time are not tackled in during medical school and everything. So thank you a lot for your time again. IFMSA gives you a warm welcome whenever you want to be with us, and thank you a lot for preparing this.
Anytime. I just hope this was helpful.
Yeah, thank you a lot, and thank you guys for being for following us during the webinars this last week. And stay home, stay safe, and everybody have a good night, and keep going on with what IFMSA Guatemala and IFMSA has prepared for you. Thank you, Hiva, and
Good
good
night.
night for everybody.
Lo siento, me bloqueé un cacho.
Espérame que no termine el broadcast.